Now we'll be discussing a very interesting CT scan of the brain. Now this is the CT scan of the brain, and when you can see what we can very nicely appreciate is this. In this area, basically what we can see is you can focus on these films and these films. So what we can actually make out that these are pretty enlarged. These are the two lateral ventricles where the CSF is produced and CSF is kept. These are much enlarged. You just compare these, these, these are the lateral ventricles, which are very small in caliber. But when we see this in this, they are extremely enlarged. So this is basically, these are the two lateral ventricles. Lateral ventricles means first and second ventricles. And third and fourth ventricle, they are not usually very well appreciated, or we usually are not worried or concerned for third and fourth ventricle. But in this image, we can see the third ventricle as well, and it is very pretty much obvious. We can find the third ventricle always in between the two thalami, in between the two thalamus. So we must know to find out the thalamus. These are the two lateral ventricles. I'll show these things here. We have to simply find out the two uh, lateral ventricles, and at these lateral ventricles we can see this is the caudate lobe, and just behind the caudate we can appreciate this thing very very well and very clearly, that this is the caudate, and just behind this is what we have is thalamus. So in between the two thalamus, what we have is the third ventricle. So this is the third ventricle, and this is very well appreciated. These are the two caudate lobes. These are the two lateral ventricles, and these are the two thalamus. These are the two thalami, and between the two thalami, what we have is enlarged third ventricle, which is not very obvious in most of the CT scan, but in here it is pretty well enlarged. And below the midbrain, what we have is fourth ventricle. So we must know the anatomy, that this is the foramina magnum through which the spinal cord goes, and before going, what we call it as is medulla oblongata. So this is medulla oblongata, this is medulla oblongata, and this medulla oblongata is continued as pons. So this is pons. How we can identify pons is this is the basically posterior fossa, this is middle cranial fossa, and this is anterior cranial fossa. So this is basically posterior cranial fossa. In the posterior cranial fossa, what we have is cerebellum. So this is all cerebellum. This is all cerebellum, and cerebellum is connected by midbrain, and below that is pons. Below that is medulla oblongata. So this midbrain is very typical butterfly shaped. So this is butterfly shaped midbrain, which is followed by this pons. This is pons because these pons is connected to the cerebellum. These are the cerebellar connections of this pons. So this is pons, this is pons, and this is all cerebellum. So we can see this is the fourth ventricle. If we can very nicely make out, this is the fourth ventricle. This is the fourth ventricle. This is fourth ventricle. So this fourth ventricle is getting compressed. That is the reason why this all pressure is transmitted to the third ventricle and first and second ventricle. So these are the occipital horns of this first and second ventricle. So these ventricle dilatation of first and second is very uncommonly seen, and whenever it is seen, it is because of some obstruction, some pathology at this posterior cranial fossa, mostly at fourth uh, ventricle. In this case, this patient has this significant, if you can very clearly make out, there is significant hypodensity of this left cerebellar area, as well as he has multiple hypodense lesions or pathology in the right cerebellar area. We can also make out that there is some hypodensity in pontine area as well. This patient had posterior circulation stroke. This patient had basically significant bilateral cerebellar infarct. This infarct caused edema, and this edema then caused this obstruction or compression of this fourth ventricle, leading to dilatation of third ventricle, first ventricle, and second ventricle. We can also make out that because of this dilatation of first and second ventricle, the sulci gyri are much less apparent in the parietal cortex. This is all parietal cortex. As we know, this is the uppermost portion of the cerebral cortex. In this, if you can simply see, you are not able to very crystal clearly see the sulci. The sulci are the gaps in between the two gyri. So see here we are not able to see very much clear sulci. Compare in this. See how beautiful he has sulci. He has here, he has here, he has here, he has here, 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 here. So he has very prominent sulci. But in this case, see he has plenty of sulci because the edema is not there, the compression is not there, but because of the dilatation of these ventricles, this gray matter as well as white matter is under pressure. That is the reason why the sulci gyri at this parietal area, they are not obvious. So this is very beautiful case of bilateral cerebellar infarction and involving the pons, causing pressure over fourth ventricle, causing dilatation of first, second, and third ventricle as well, and with a significant diminution of this sulci. So it's an interesting case. Thank you.